Mediterranean region. So it's a region that covers 22 countries with 500 million people living there, and the GNP per capita is $1,700. That doesn't sound very much, but you have to keep in mind it's an extremely diverse region. You have rich countries like Qatar and the other Gulf states, but you have also a very poor, some of the poorest countries in the world, such as Afghanistan, belonging to the same region. So the mortality rate here in the Eastern Mediterranean region is 60% caused by communicable diseases, and here the major killers are malaria, TB, and HIV. 40% of the mortalities are caused by non-communicable diseases, and here in particular, cardiovascular diseases are the leading cause. It's estimated by the WHO that this is going to change. There will be an increase to 60% by non-communicable diseases expected until 2020. So, as we heard yesterday, the health system in many states here needs major improvements, and therefore it is necessary to invest in local research and education initiatives. That's the only way how the situation for the patients here can really be improved. And that requires transfer of know-how and technology, which ultimately should lead to the development of affordable drugs and treatments for the people in the region. So how is the health situation in Qatar itself? So I took this statistic from the WHO, from their yearbook in 2002, and what you find is, so the major cause for mortality are ischemic heart diseases, and then you have diabetes on the third place, and further down the road you have kidney diseases. And those diseases are all interrelated, and diabetes is one of the major culprits here, obviously, for causing mortality and constitutes one of the really major health risks for people in Qatar. So what are the economical and medical consequences of diabetes? So it's estimated that 100 million people worldwide have diabetes, and this number is likely to double by 2030. And again, the WHO estimates that 1.1 billion people died from diabetes alone in 2005. Almost half of the deaths occur under the age of people under the age of 70, and 55% of diabetes deaths are in women. For Qatar, it's estimated that more than 20% of the population are diabetic, and as we heard today, this number is likely significantly to increase. And I was really astonished. It was really astonishing for me to hear that 80% of the Qataris are at risk to develop diabetes. This is really a dramatic number. So, what are the medical consequences for the patients? So, diabetes causes renopathy, and that's an important cause of blindness. It causes also neuropathy. So, common symptoms here are tingling, pain, numbness, weakness in the feet and hands. So obviously, it majorly impacts the ability of the patients to work and to have a normal life. Reduced blood flow and neuropathy in the feet increase the chance of foot ulcers and eventually limb amputation. And those who have been in the